and welcome to 72 Dragons Health. Today, we have the pleasure of speaking with Brooke Erickson and Beatrice Arnfield. Welcome to this interview, Brooke Erickson and Beatrice Arnfield. It is an honor and a pleasure to have you with us today. Brooke Erickson is a student of psychology, health medicine and society, and global health. And Beatrice Arnfield is a student of biology, health medicine, and dedicated senior students at Lehigh University. They're both members of the impactful Mothers of Sierra Leone project, leveraging their combined skills in film editing, qualitative research, and more to address maternal health challenges. Their shared commitment to this initiative represents a passion for healthcare advocacy and social impact within their academic pursuits. Brooke Erickson has immersed herself in diverse roles through her engagement, ranging from research assistantships to leadership positions in academic and social organizations. She showcases a passion for understanding healthcare complexities and a commitment to driving positive change within communities. Beatrice Arnfield is a dedicated and multi-talented individual. Her diverse work experience showcases her adaptability and commitment to various responsibilities alongside her academic pursuits. Holding certifications in social and behavioral research and drone society, she epitomizes a holistic approach to learning and applying skills across disciplines. My name is Dr. Pietro Aparicio from 72 Dragons Health. Thank you for joining us and for sharing your experiences with us today. Without any further ado, let's begin. Brooke, what inspired your interest in bridging the gap between healthcare, society, and psychology, especially concerning maternal and child health issues?
Yeah, so coming into Lehigh University, I wasn't entirely sure what I wanted to do. I knew I was interested in health in general, but through some of my health medicine and society courses, I became very interested in public and specifically global health. I think I got the terminology for my interests in health equity and the social determinants of health. And I'm particularly interested in improving access and availability to quality care and services. And I think that this is kind of the essence of some of the challenges with the high maternal mortality rate in Sierra Leone, where people aren't sometimes able to access those quality resources and services and get the care that they need. So combining that with psychology, I think that kind of cemented my interest in research as I'm able to connect with people and understand their experiences in some of these challenges like a high maternal mortality rate. And that made me interested in research, especially because I want to promote behavioral change in some of these populations experiencing challenges like this.
Thank you for sharing. Beatrice, considering your background in biology, health medicine, and society, how do you perceive the intersection between these fields and your practical experiences in healthcare?
Yeah, so I think the fields of biology and health medicine and society are inherently pretty intertwined and connected, especially in the healthcare sphere, because you have taking in science and biological principles of health and then intertwining that with societal factors that are influencing the patient's abilities to seek care. So when you're working in a health profession, it shouldn't just be about what's happening in your patient's body and how to treat that. You also have to try to understand where your patient is coming from and what different social and cultural and economic factors are impacting how they might be able to access care or how they might engage in that care throughout the process of trying to treat whatever they are dealing with. So in Sierra Leone, I definitely saw in healthcare facilities and heard about how societal factors such as socioeconomic status can really influence how a mother is able to reach a hospital. There's a lot of problems with transportation, and if you don't have enough money to provide yourself with transportation to the hospital, you can have some poor health outcomes. So I think it's really important for people who are going into healthcare fields in general to understand the basis of the science behind health and also the social factors that are influencing this. So when they're treating patients, they can really view health as a holistic thing and focus on patient-centered care.
Thank you both for pointing out the importance of societal issues that impact health. Now, you both work in the film Maternal Mortality in Sierra Leone to become a healthcare worker. The film was showcased in the American Public Health Association Film Festival 2023. What were your roles in this film production? And can you provide a bit of highlights about the film?
So we actually didn't have any role in producing the film itself. Our peer, Christine Guan, who was a part of the Mothers of Sierra Leone project 1 year prior to us, she produced the film, and it's a great film. But we've been on the other side of the research end of the film, so we've actually heard feedback from mothers, healthcare workers, and community members in Sierra Leone who have had the chance to watch it through focus groups. And some of the data that we've received from this film was hearing that it actually makes mothers and women in general just more motivated and inspired to join the healthcare industry. And our film also highlights how there's very qualified women in the healthcare industry and the training that they had to become these healthcare professionals. And we found that people are able to feel more comfortable and inclined to go to hospitals and healthcare facilities to be treated and seen by these healthcare professionals just because they're more aware of what they had to do to become in this industry, somebody who's very qualified. So we've had some really great feedback. We did not have a role in it, but we've seen some very amazing things through our focus groups. So.
Thank you, Dan. Data analysis is a very important part of the work that we do in public health. Beatrice?
Yes, just going off of that, I also didn't have a direct role in producing the film, but I've been involved in the research as well. But during fieldwork this past August, Brooke and I were both able to film hundreds of hours of content with interviews and other content at various healthcare locations. And we have both created films at returning to the US. I've made another film called Warning Signs During Pregnancy, and Brooke has made a film about mental health care in Sierra Leone. So these are also going to be available soon for watching.
Wonderful. Looking forward to see those films. Now, this question is also for both, and maybe we can start with Beatrice. Could you share a specific moment or experience while collaborating on the Mothers of Sierra Leone project that significantly impacted your understanding of maternal health issues?
Yes, of course. So one specific moment that it kind of happened a few times when we were in Sierra Leone was seeing how the healthcare workers really interact with their patients and form really strong bonds. They would have these things called health talks where a bunch of pregnant women would come to the clinic and they'd sensitize them on a specific subject, and they'd get up and they'd sing and dance, and they'd have songs that were relating to healthcare issues and talking about how they should come to the hospital. So they really made the maternal health education fun and exciting and active for the mothers. And I think it really stood out to me in how community health is so important, and creating a network of pregnant women and healthcare workers who really know each other and can spend time together and have fun, but also talk about the serious issues and get what needs to be done. And just having that network of support, I think, is vital to helping maternal health issues all across the world.
Yeah, I can build off of that. Just to echo what Bea said, I do think that the support in the community that people in Sierra Leone have, especially in the healthcare field, is just amazing. I think I came up with 2 issues that kind of demonstrate the health equity side of things. So one moment that stood out to me was it was pouring rain in Sierra Leone, And because of this, they had to cancel the antenatal care day clinics for women because they weren't able to reach the healthcare clinics. The roads weren't paved, so there was a lot of barriers with transportation and accessing healthcare facilities. So that just kind of demonstrates the challenge we were talking about earlier, with a lot of barriers to getting those quality resources and care that mothers and women so desperately need for themselves and their children. And then I think another one that was really interesting to me was with the topic of breastfeeding. A lot of women had either issues like connecting to their children, or some healthcare workers would talk in our interviews about how women can have inverted nipples and the stigma that would come along with this. I think breastfeeding is something that's very emphasized there as important for the nutrition of their child and the well-being of their child. And something that was interesting to hear about was the disconnect that women could possibly have and the repercussions this would have on them and their mental health. And it's difficult to know like other opportunities to nourish your child if you're struggling with breastfeeding. So this was interesting just to hear about like the stigma aspect of that and the pressures that there can be on being a good mother, quote unquote, and and just kind of like the societal factors and expectations of being a mother in Sierra Leone.
Thank you. Sounds like a very enriching experience. Now, this question is also for both, and if I can start with Beatrice. Looking ahead, what aspirations do you have in integrating your academic knowledge and practical skills acquired from diverse experiences into your future career?
Yes. So in the future, I'm still deciding exactly what path I'm going down. I came into Lehigh as a pre-med student, but throughout my experiences here in Mothers of Sierra Leone, I've learned a lot more about public health and global health, and also through my health, medicine, and society major. It's really sparked my interest there. So I've been considering applying this knowledge that I've had and these practical skills into getting my MPH in the future, and specifically focusing in maternal and child health. But I'm not 100% sure yet. I'm still kind of weighing my factors because I have also always been interested in healthcare. And as I spoke earlier, I think I could really integrate these two fields that I've worked in college, in my biology and health, medicine, and society, and apply this in the healthcare sphere as well. So I'm also considering applying to PA school in the future, but those are my aspirations for now.
Great. Yes, lots of opportunities out there for you. And Brooke?
Yeah, so we're both graduating this May. So after this May, next fall, I'll be starting my Master of Public Health, and my main interests fall in global mental health. So some of the things that I'll be trying to focus on are continuing research like what we've done in the Mothers of Sierra Leone program, and learn how to improve those health-seeking behaviors as we spoke about, as well as improving access and availability of quality care and resources, especially for these low-income communities. So that will be my focus and goals, hopefully.
Great. Yeah, public health, it's a great field. I think you'll find it very rewarding. Brooke Erickson and Beatrice Arnfield, thank you for your dedication to maternal and child health care. Your passion for healthcare advocacy is inspiring. Wishing you continued success in your impactful endeavors. Thank you very much.
Thank you.
Thank you so much.